Do weightlifters get bigger muscles if they eat animal proteins?
There haven't been a lot of good studies showing animal protein versus plant protein in bodybuilding. There was one study that kind of suggested whey protein was better than soy. There were a couple others that I mentioned in my book that show there was no difference between the two. Whether you're doing soy or doing whey, it was the same effect. There are plenty of very successful plant-based bodybuilders and more coming over the years. My general answer to that is no, it doesn't make a difference. Yes, animal protein has more leucine. More leucine means more IGF-1. More IGF-1 does mean more cancer, may mean more aging, but it does mean bigger muscles. But a plant-based lifter, if they're getting enough soy where they're getting enough leucine to get enough IGF-1 stimulation, they should be fine.
Does animal protein affect your bones, and if so, how?
Animal protein and its effect on bones is kind of hard to determine right now. We used to think that, eating, like drinking milk, protected your bones. But at this conference, Dr. Walter Willett, who's one of the top researchers in this field, found that that wasn't true. And in fact, may be quite the opposite. More dairy may lead to worse osteoporosis. There's so many factors that go into your bones. Protein is a factor in that. Does it have to be animal protein? No, but you need to have some protein for your bones. You have to have magnesium. You have to have calcium. So there's so many, doing resistance training helps the bones. There's many different factors, so it's hard to give a definitive answer, but you could certainly have very healthy bones and be a plant-based eater for sure.
What are the long-term risks to a high animal product diet?
A long-term risk to high animal product diets are going to be heart disease, diabetes, obesity, stroke, certainly cancer. I mean, these are risks. How definitive we are on the risks, it's hard to say. We know that processed meat carries a class 1 rating as a carcinogen from the World Health Organization. And that class 1 means it definitely causes cancer. Red meat as a class 2A means it probably causes cancer. So all these things are definitely a risk factor for eating animal protein.
Do the Maasai people do well on a high animal protein diet?
Yeah, so the Maasai are often referred to as, look, they eat a very high animal protein diet and they do great. So there goes all your theories, Dr. Davis. Look at the Maasai. Yeah, but wait a second. The Maasai, first of all, are moving a lot. All right, they're shepherds. Number 2, the Maasai don't eat a lot of calories. They live a subsistence diet. We know that a low-calorie diet, regardless of what you're eating, is going to help you with longevity. There's been multiple studies with that. So they're eating a very low-calorie diet, which keeps their weight down. So genetically, their weight is down. The fact that they're moving a lot, the fact that they don't eat a lot, that keeps their calories down. So they don't have obesity, so they're doing well. The other thing is, in 1976, Dr. Mann did some very interesting things. He did autopsies. And yes, they've got heart disease. They just die at an average age of 46 to 56. So they're dying before they're getting all the heart attacks. If they were living longer, we would probably see more heart attacks in them. They also have very wide dilated vessels, whether that's because they live at altitude or whether this is because of their constant motion. It's hard to say, but they're not getting the constriction, so they're not getting the symptoms that they might have, but they definitely have heart disease.
What should people with Crohn's and colitis eat?
Crohn's and colitis, that is one disease process, inflammatory bowel disease, where I really believe in a plant-based diet. There have been several really good studies showing that patients, if you get them into remission and then start them on a plant-based diet, the chance of them getting a recurrence of their inflammatory bowel disease is much lower with a plant-based diet. Why this is, many different factors. It may be a change in the microbiome, increase in microbiome that creates short-chain fatty acids like butyrate, which are anti-inflammatory. But I definitely think if you're suffering from inflammatory bowel disease, you should definitely look at a vegetarian or vegan diet.
Does that go the same for IBS, irritable bowel syndrome?
I think a plant-based diet can help with irritable bowel syndrome. Irritable bowel syndrome is kind of a catch-all term. We say, anybody that's got bowel problems that we don't know what it is, we call it irritable bowel syndrome, but there's probably multiple things causing irritable bowel syndrome. It could be a problem with your irritable bowel syndrome. It could be a problem with your microbiome. It could be SIBO, like a small intestinal bacterial overgrowth that might require some antibiotics to treat it. I mean, there's multiple different causes of IBS, so multiple different things to treat it. But I think a plant-based diet could certainly help. You know, in certain situations, a plant-based diet can hurt irritable bowel syndrome unless you get things like SIBO worked out first.